Unipod, the podcast for all things management software.
Hello, everyone. Welcome to Unipod, the podcast for all things management software. And today we are with Paulo Gonzalez, the co-founder of Wellnite, which will tell us all he knows about mental health management software. We're going to explore a whole new vertical today for the first time, actually. So that's cool. Paulo, thanks for coming in. Thanks for joining. Really appreciate your time. And please introduce yourself. Let us know who you are and what brought you into the management software world.
Thanks a lot for having me, Sharon. It's my pleasure to be here. I'm Paulo Gonzalez. I'm co-founder and co-CEO of Wellnite. We're an online mental health care platform. We started 6 years ago. My co-founder and I were both working in diabetes, and then we met through YC Startup School, which is kind of like a little thing that YC had for founders to mingle. And then we quickly realized that a lot of the folks that we were talking to, they were kind of like not interested in the solution that we were building for diabetes, but they were actually struggling to get access to a therapist, a psychiatrist. So kind of like we decided, okay, this is what we need to do. We need to pivot towards mental health and kind of like build in that space so that we can provide people with what they need. And fast forward to today, we're basically kind of like in network with the major or the largest insurance companies in the United States, offering services across all 50 states and expanding internationally as a management software platform for mental health care providers across the world.
Amazing. So let's start from the beginning. You mentioned starting at a different point with different thoughts in mind. Like you mentioned diabetes, and can you start from what brought you there and what connected you with your co-founder and how the journey started, basically?
Yeah, so basically, like I'm from Spain. My mom from Brazil, my dad from Canary Islands in Spain. From my mom's side, some of the family are type 2 diabetics. So basically, I said, okay, well, if I, actually will any day have any issues with that, I might actually want to start building a company to solve for my future issues. And then I moved to the US and I realized that it's such a huge problem here in the United States. So that's where we started.
From wanting to build like a really health tech business to solve the disease of diabetes, that was the initial thought? Okay, that's a big
Yeah,
shift. I mean, from health technology to like platform. Yeah.
right.
How did this shift happen?
So I'm a pharmacist by training. So I've
Mhm.
always been kind of in healthcare and I've always wanted to start a company. So that was kind of the first angle that kind of I say, okay, I saw this problem and I want to try to build something to support and solve this problem. But basically that's when I realized that, the people who were actually suffering from it right now, there was already kind of solutions that they were already using and that wasn't kind of their most important kind of like pain point. And that realization came through kind of like working with UCSF in San Francisco, doing kind of like a lot of customer discovery with patient diabetes, and then finally meeting my co-founder who was also working in diabetes before and was kind of coming to the same conclusions together. And meeting through Y Combinator Startup School, we kind of like sat down for a 15-minute coffee. It turned out to be like a 2 hour and a half meeting. And we said, okay, we need to do something in mental health because that's basically where people are struggling and really need our help. Right. So we kind of like found a doctor on indeed.com and we asked the doctor if he would be willing to take some calls from some people that we would already discuss with. And he said yes. And those people kind of like paid us $30 for a 10-minute call. And that's how we started basically.
Oh, wow. Okay. So from 5 minutes coffee, it became a 5 year plus journey or
Yeah.
something like that, right?
Definitely. Yeah.
Yeah. Okay. Nice. So how did you validate? So this time you really probably wanted to validate the pain point, right? Before you dive deeper into the journey. So take us through pain point validation. What is important to really check? How do you do it? And when is the moment that you say, okay, there is a real pain point here. Let's go for it.
I mean, we were talking to these uh, patients or people that were kind of like having chronic conditions, and both my co-founder and I were kind of like seeing that people were actually struggling with behavioral healthcare issues, like mental health care issues mostly. And actually, so Wellnite itself was a diabetes coaching app that my co-founder had started. And through those conversations, most of the conversations through the coaching app were not about how to get better in terms of diabetes, but were more about, how do I basically get a better relationship with my husband? How do I actually get out of the stress from my work? It wasn't kind of like that thing. And from my conversations from the previous company was also kind of like, how can I, my problem is that I want to see a psychiatrist and I've been waiting for 4 months in a wait list, right? So why the heck I cannot get access to that? I don't care about my metformin. I get it every month on my mailbox, but I need to talk to a psychiatrist, and there's no psychiatrist available. So that was when it was clear that we needed to do something, in the mental health care space.
Okay. Okay, so it's actually like the same customer, let's say, but you just understood that this specific customer has a different pain point than what you
Mhm.
originally thought. Wow. Okay. Do you have like tips for asking questions these customers? Because I can imagine when trying to validate a pain point that you come with a certain set of questions that are supposed to serve the original purpose that you already came with. So, how did you get to the point or get to know them well enough to say, okay, actually, there is something completely different than what I thought?
Yeah, actually, that's a really good question. And I wish I knew as much as I know now, the moment that I started, and it has changed through these stages. And through these stages, as I also learn and improve kind of like the way that I ask these questions and what I focus on these questions. From the very beginning, the most important part for me specific in my case, I cannot talk about everybody because everyone is different. But from my own experience, in the beginning, it was more about not being shy and being more inquisitive with my questions. That was kind of the main thing, the highest priority thing that I could improve, that I realized, oh, this is a big realization. I can actually ask any questions to anybody, and or I already have a no answer by default. So I might as well go and actually ask whatever I want. I mean, as far as you're basically kind of polite and kind in your questions, right? You can ask anybody anything. It's their choice to respond or not. That was kind of like big for me in the beginning, 6 years ago when I was starting. It wasn't as clear. And then as we keep adding more products, we keep like learning more about our different customers. We've launched so many products since then, right? Since what we started to who we are and what we do right now. There's been like many kind of iterations, many pivots, everything with the same mission of making high quality mental health care accessible to everybody, but many different offers, from medication management to therapy to working with payers and insurance, offering directory and accessibility, to working with employers, to kind of like working as a management software for the providers, to building SaaS tools for the clients themselves. We have a very broad you know um, rainbow, I would say, of products and services. And through all those iterations and all those products, I've had to learn from the different customers, the different users, right? In our cases, customers and users are different. And sometimes the customer is the insurance company, but the user is the patient. Sometimes the customer is the provider and the user is also the provider.
Hmm.
So, I had to learn how to differentiate who is the payer, who is the customer, and who is the user. That came in a different phase. And then so number one is like, don't be shy. Number two, understand who you're asking and who is the person that you're asking the questions. Make sure that you understand what's the role of that stakeholder. And then number three, as you keep getting better, as you keep growing, as you keep asking more, active listening. That's something that I've spent, let's say, the last 4 years trying to improve, and not just me, but our team also kind of like doing workshops, bringing people that are, specializing in communication, and kind of like having an emphasis on active listening, so that,
Okay.
the team basically understands, because communication and asking questions, it's fine, but if you're not understanding the meaning and the context and really what somebody's trying to tell you, you're not going to get the hidden keys and the insights that you really need to build a great product or a great service, right?
Yeah, no, definitely. I mean, first of all, it's a great tip also for me as, the person asking the questions at the moment. So yeah, not being shy is maybe something a little bit underrated because it really takes some courage to, open up, and you have only 30 minutes with the person or 45 minutes with a person for the first time, and you really need to get to pick up his brain and understand his real pain points. So that's like a lot of layers to unfold, and not that easy. I would agree from my perspective as well, but I think that as a founder of a management software, but also as generally a founder, you really need to build this skill and build this muscle of being able to really ask questions, being critical of yourself, and really actively listening, like you mentioned. So I think that that's super important to highlight that. And then you started talking about the whole rainbow of features or products that Wellnite already has. Can we talk about like the first product you launched, and then we will get more into the management software aspect of it?
Yeah, I mean, first product, as I said, it was just, facilitating that connection between a doctor that didn't know how to get patients and patients that didn't know how to access a doctor. And basically kind of like as a very scrappy, very, resourceful and lack lack
Mm-hmm.
of resources startup, kind of like how did we facilitate that in the early days. And that was kind of like the first MVP, right? To kind of like then adding psychotherapy, we would see that like the people that were actually talking to the doctor was actually having therapy in other platforms. So we say, you know what, this person is already coming here for medication. Why are we not able to bring a therapist as well and just provide all the services that this person requires in one place, right? So, from there to kind of like all the necessary kind of products and services that are needed to facilitate the access for anybody that basically is not able to pay out of pocket, right? Just basically kind of like billing, credentialing, verification from the insurance, right? So again, and these are kind of products and features that you could say, okay, who is the user, and then who is the payer, and how do you build it, and what do you need to build, kind of like, also focusing on the provider. A lot of features that we've built for the providers themselves, like how do they basically spend the time when they are seeing a client or seeing a patient. What do they want to spend time versus what do they not want to spend time, right? They don't want to be spending time on notes and kind of like all the stuff that really is required from the insurance perspective or from the clinical process. How do we make that much easier for them? So we have what we call Wellnite Notes, which is an AI feature that allows the providers to save time while they're on the call with the patient, and the notes are kind of being generated as they speak. They can see the patient's history on the same screen, same as this kind of like Riverside thing that we're seeing right now, but it has kind of the patient notes, the doctor notes, the history of the patient. It has kind of like the ability to schedule an appointment for the next session right from the call, so you don't have to get distracted. It allows, we have like Wellnite exercises, which is another AI product feature that allows the provider to design specific exercises for the patient's specific mental health care needs. So now providers have this powerful tool that they don't have to send the same general exercises to all their clients. They can focus on giving each of their patients, each of their clients, the very best specific exercises for each of their use cases with a simple drop down click of a button, 2 minutes. Products and features like Wellnite articles, allowing providers to kind of focus on the topics that they like so that they can get visibility and patients can understand, okay, these providers specialize in this, not just because there's a label that says it, but because there's articles that this provider is writing about this and how do we make the provider experience so easy and so professional that they are actually willing to go ahead and do that. So all of that supported by AI. We just launched what we call Wellnite Audios, which is also an AI voice generation tool for providers so that they can actually do the same thing with that we're doing with articles, but it's actually audio content generation.
Wow.
It's really cool.
Like a
And
podcast.
like a podcast. And we will actually, the idea is in the future, we're actually going to allow these providers to actually do podcasts among themselves as well.
Wow. Amazing. Okay. Wow. So
Mhm.
many features. You did a lot. Okay, so I'm interested in this. So you started, your perspective was first on the patient, right? So you started from the patients. Then you like connected them with the providers. Can we call this type of platform a marketplace when you the time when you
Yes.
connected between them? Okay, so it started from this marketplace and then you a little bit shifted towards or added the layer for the providers to also manage their business more efficiently. And that's what we call management software, right?
Right. And yes. And there's actually like an approach that we're a little bit different from other companies, especially, these software as a service technology companies and management software technology companies that they follow this, very specific agile lean methodologies where, whatever is not, the focus, we kill it and we move on and we focus on one thing. We, for good or for bad, we are not like that. We basically try, we launch, and we don't kill it. We just leave it there, but we focus on what's actually taking off, because we feel like a product rich or a feature rich product, it's better than just like a simple solution. As far as the UI is clean, as far as that it's easily understandable, the more features you have, the more you can actually benefit more users, right? So we're kind of a little bit contrarian on that approach of like, oh, only focus on one thing and then just stick to that. We are not a venture backed company, so we've actually had to iterate many times and kind of like grow from many angles as much as we could, as possible, as fast as possible, so that we could pay the bill next month, right? So in our case, our trajectory has been different from all these other companies that are actually venture funded or venture backed, in which sense that we just keep adding and we keep kind of compounding our products and offers, and we just basically put resources and efforts on those that are actually organically taken off.
Was there a time when you just left a feature there? You didn't focus on it so much because it wasn't that successful, but after a while you suddenly started seeing more traction with it and something happened and you were happy that you didn't kill it?
Oh, that's actually a really cool question. I think one, I think I have a lot of them that are zombie features that are in our platform.
Mm-hmm.
Some people use it, but majority of people don't use it. The people who use it love it and keeps using them. And the thing is, like, the vast majority don't like it. So we could have killed that product and that's it. But we just decide to leave it there. We just don't keep iterating or kind of like enhancing it. There's another thing that we do is like we just launch, the minimal versions of every single product and feature, and then we just keep improving and iterating that product and feature, making the product and feature better over time. Like our first version of articles was nothing to what it is today, or our first version of notes wasn't the thing that it was today. Our first version of audios is nothing that is what it's going to look like in, like, 3 weeks, if you're paying attention to our app and everything you're gonna see. So one example would be, I think, like Wellbits. Wellbits is a referral program and reward system that we have for our providers, that basically kind of like every time that a provider brings another provider to the platform, they get Wellbits for that referral, but also they keep earning Wellbits as the referral also keeps earning money through our platform. So it's kind of like a little bit of a passive income. As the more providers you bring to the platform, the more
Oh,
money you.
wow.
Yeah, it's not so much. They don't get rich, they don't get, but it's a little
No, but
bit
it's super
incentive.
smart.
Mhm.
It's super smart, and it's something that, other management software founders can implement and think of in order to attract more users. And it's also like very cross vertical. So it's not something specifically for this specific vertical. So also I'm talking to gym management software founders that are going to listen, and this is a cool idea where gyms can also invite other gyms to, and yeah, so that's super unique. Never
Mhm.
heard about it. Is this related to the Super Mario
Yes.
ad that I
Yes.
saw?
Yes. Yes.
Okay, you must tell our listeners about it, because it's really cool, what you did there and all the metaphor and everything.
Right. So we thought it was, cool to kind of like make an homage, or like kind of like look at our therapists as super therapists, right? As we want to make sure that we take care of them, we bring them all the tools so that they can become these super Mario super therapists, right? And basically the it's their digital practice, which is our management software tool for therapists. And when they get into the digital practice, that's when they're coming into the super Mario world, and they become like super therapists. And why would they become super therapists? Well, because they have all these AI enhanced tools that make their job much easier, save a lot of time, but also because, like, if they bring therapies, they also can they earn more bonuses, and there's gamification involved with this Wellbit system that we were discussing. Like, you have your digital therapies, you bring colleagues to join their own digital therapists, and because they do that, you're also earning more points or Wellbits, in this case, that you can cash for money and kind of like earn rewards. And that's basically for super therapies. And on that same saga of super therapies, now we launch what's Super Coach, which is basically an AI advanced mental health care coach that basically allows continued care between therapy sessions for the clients. So a lot of providers don't want to be chatting or sending messages in between sessions. They want to kind of like go to the session, discuss with the client. But if you have like 50 patients, right? Imagine receiving messages from all your 50 patients every day saying, "Oh my God, this has happened to me." Super Coach is basically an AI advanced mental health care coach that basically is available 24/7, and it's basically trained on our DBTs and CBTs kind of data, and basically kind of tracks your progress. It's connected with all the features, AI features that we have in our platform, like your mood progress, your GD7 progress tracking. Sorry, PHQ-9 is the measurement for depression, is a clinical measure for depression, and GD7 is the GAT7, which is the clinical measurement for general anxiety disorder. So the coach is connected to that data, and it's able to track your progress to that. It's able to track how your mood is, how you're journaling. We have a journaling feature for the patients, and it can also, if you give access, you can also check that journaling, and hey, how was your conversation with your daughter? How was your conversation with your husband? Yeah,
Okay,
it's really
wow.
cool.
Yeah, it sounds cool, but also like I'm also going to therapy. I mean, it would be kind of weird to talk to an AI chatbot. I was even about to ask you, like, how do people accept online mental health care? Because that's also new, but AI mental health care, that's even a whole other layer. So do you feel a difficulty, and do you feel like there's an education in the market needed in that aspect, or is that just me behind everybody else?
Well, I feel it covers that purpose, right? This is not a replacement for therapy. This is not a replacement for like a in session therapy with a specialized provider. Um, None of that. This is just for those kind of like in between session kind of questions, queries. Like, a lot of times, like, people just need to vent about something, but not necessarily, get a kind of like a professional clinical answer or solution to what they're going through. That's what therapy is for. But
Hmm.
at the same
Yeah.
time, you feel the need to kind of like get it out of your chest, right? And that's why
Yeah.
Supercoach is it's so good, because it's backed by all the knowledge, all the information is backed by real data from yourself, And it's basically kind of like, it also knows that if something is really critical, how to say, hey, you should book an appointment with a therapist
Mm,
right away. And it basically allows you
nice.
to do that on the chat as well.
Okay, that's really cool. I mean, now that I'm thinking about it, I also like talk to ChatGPT sometimes when I need to vent. So probably this is a much better trained ChatGPT to talk to about my issues. So DBT and CBT, are those therapy
Yeah, that
treatments?
dialectical. Yeah, so basically dialectical behavioral therapy and cognitive behavioral therapy, those are usually kind of like the most used approaches in when it comes to therapy. But it's not that the coach is actually doing therapy. The coach is just coaching and is not allowed to kind of do any diagnosis or any kind of like provide any clinical treatments. It's just guiding and basically understanding when something needs to really kind of like be talked to a therapist,
Be escalated. Yeah.
be escalated.
Okay, so all the online mental health treatments are like first aid, or do you serve also like psychiatrists and psychologists and stuff like that?
We do have psychiatrists and doctors in our platform, but we don't offer psychiatric services that require in-person psychiatry or controlled substances or anything that basically requires a in-person type of treatment, like anything that is
Mm,
more severe than mild to moderate anxiety or depression, or anything that really requires you to see a something in person. We don't get into those type of conditions.
okay, interesting. Yeah, go ahead.
No, I would say that like most things we see is like couples therapy, to moderate
Mm,
anxiety and depression, maybe like trauma, childhood issues, relationship with food, relationship with um, job or stress, work related stress. There's a lot of LGBTQ identity issues, a lot of things that are part of like therapy but are not kind of like really in need of medication to actually function or having like a normal life. Yes, we can prescribe SSRIs and beta blockers and stuff like that. We do have doctors, but usually we don't do like medication managed for ADHD, for example. We don't
mm.
provide that type of services. We can provide therapy, you know, base management for ADHD, but not medication management for it. Yeah.
Okay, yeah. Okay, that makes it like much clearer. And so actually the patients are everyday normal people, and it's not specifically, so your users or your
We call
payers,
them
your
members.
users,
Members,
your
yeah.
members, okay, are just can just be me and you needing to vent about something. And
Yeah. I'm a member.
okay. Okay, we
Uh,
have a confession here.
yeah.
So I looked on your website and I saw something about network and community. Is that I mean, how does that fit into your product, and what exactly do you do in that aspect?
Yeah. So network is the network of providers that we work with, right? Um, Large network of 2,500, mental health care professionals that we work with in the U.S. alone. And the community is basically, everything that we're building around Wellbeats and, all the content that we're putting together, all the tools that we're putting for them so that they can, increase their reach and visibility. So
Mm-hmm.
that's the provider network. It's, all the providers that are engaged with Wellnite that basically have access to all these tools and benefits. By being with Walnut, you have, access to being in network with all the largest insurance companies in the United States, which basically allows you to see any clients that are in network with those insurances, allows you to use kind of platform hour support, getting credentialed, the billing part, all the software tools for being being able to see the clients online with quality HIPAA compliance, and all these AI and all these kind of great solutions that are there for you so that you can professionally provide high quality mental health care online.
And, mentioning AI again and HIPAA compliance. So how do these two live together, and what do you need to do, or what are your challenges in this area? Because you are dealing with very personal and fragile information, but you're also very techy. So yeah, what are the challenges? How do you overcome them?
The challenges is to make sure that you're treating the data in the most kind of like protective way as possible, that if you're using any third party platforms, that those third party platforms are HIPAA compliant, and that you have business associate agreements in place with those third party platforms, and that you're basically treating the data with utmost respect and protection. And we do that for all of our AI solutions. We don't pass any personally identifiable information or PHI. We keep all that data in our servers. We use kind of like, GCP, Google Cloud Platform, and our Vertex servers in there, so that make sure that that data is not shared in any way possible with anything that not doesn't need to be shared. Although with our AI providers, we do have BAAs in place, so business associates agreements, and you know with those business associate agreements, they basically assure us that they are HIPAA compliant, that we're HIPAA compliant, and that we're both treating the data with the most protection possible.
Yeah, well, I think what I'd like to highlight from this experience of yours is that it's not a blocker, right? Even if it's a challenge, like there are AI solutions that are HIPAA compliant, and you can still be really careful and protective with people's information, so it shouldn't like stop you from getting into that space and exploring more and being advanced as a management software. So I think, yeah, I think that's an important piece to highlight. So I like to ask some inspirational questions. Maybe they'll be a bit theoretical, but I think you can handle them. Imagine like a management software founder listening to us here, no matter which vertical. So what do you think separates good management software or average management software from excellent industry leading management software? And yeah, it can be in any area like product, marketing, sales, vision. You just what do you think that the average, normal, good management software are missing, and how they can like elevate their management software?
That's a tough question. It's very general,
It's
but
very general.
I think, from that kind of point of view, from the general perspective, I feel like you have to be obsessed with that product and that problem, right? And being obsessed is like, being relentless about knowing exactly what you're building, talking to kind of like your users. I talk to our providers every day. Like I have them like data. I talk to them too much that sometimes I say I don't want to talk to them, because like it's like incoming. They just basically reach out to me, and sometimes I say, I cannot be doing this. This is too much. There's a good amount is good, but like too much is like, because I don't have time to like do anything else.
Wow.
But that's very important, basically kind of communicating with them, knowing that, so because they are the ones that are using your product, and they are the ones that lead your prioritization, right? Whatever it's more important for your users is what you need to focus, because otherwise they're going to go to somewhere else. They're going to go somewhere else that is maybe less good than you are. Maybe the other place is not even as good as you are, but they have that one thing that is important for them, just that one thing. Everything else is bad, but that one thing that is very important for them, this other company has it, and now they're gone. And then for you to get that person back, it's double the effort. and for you to get other a new customer is also much more expensive. So retention it's the key, right? For any management software solution, it's always retention, retention, retention. And the only way to get retention right is to kind of listen to what your customers want and your users want.
Mm-hmm. Mm-hmm.
I mean, as stereotypical as it is and as general as it is.
No, but I think it loops back to your original point, about active listening. I don't think it's so I don't think it's so common to find founders that really talk to their customers on a daily basis and at this amount. So it's kind of surprising. It's not that general, actually. Yeah, I think it's super important. It builds you as someone that they can trust, and it creates a relationship. And it's not like a software that they are thrown into and like, okay, you can use it or you cannot use it. The software kind of like really has a face in that sense.
I talked a lot to providers and talked a lot to our users and stuff, and I listen and I prioritize. But there are also a lot of times too that I also know or have to say no or have to not like go in that direction. That's also very important because like it's impossible to have all the points aligned with your user, right? You cannot just have the best product, the fastest product, and also the cheapest product, right? That's kind of like it's really hard to be aligned. So a lot of times, although you listen to them, you need to also know, what are your which ones are you going to concede on and which ones are you is basically just that. That's also like a very general thing and stereotypical.
No, that's important because, yeah, I mean, you need to have your vision and you need to have the roadmap and the pathway that you want to go in the direction that you want to go in, and really listen and feed the feedback that you're getting into that direction and not let the feedback distract you away from it too much. I think yeah, that's a balance. It's worth highlighting. So how do you see pricing models evolving in management software? Tiers, basically, is it free for your members and for your and is it a paid platform only for the providers or for the members also? How is the pricing? How do you see pricing in your management software?
I think our pricing it doesn't apply to most other companies because of that same thing that I said earlier. We are not the typical company that kills products. We just keep compounding and we just basically focus on whatever works. And for different products, we have different types of models, and for others, we have others basically. We have subscriptions for D2C out of pocket. We have pay per usage for the insurance companies where the insurance pays for certain amount of that and the patient pays for other certain amount of it if they have like some sort of like patient responsibility based on their plans. And then we basically do share revenue with the management software tool piece of the provider. So people that are just using our digital practice to see their own clients, we do just revenue sharing based on all the transactions that they do in our platform. And I think that's really important for any management software and any software as a service company, especially in 2025 or especially like nowadays, because just keep stacking, SaaS or management software company on every single company's P&L bottom line. It's not sustainable. Whenever competition is going to come and they're going to change that simple thing, then you're going to see that even though you might actually have like a very kind of like retention driven product where you have like a lot of like data traps, or you have like a lot of like things that, oh, this company is very invested with integrations and APIs. When it comes to usage based kind of software, it gets to a point that the cost is so high that it doesn't really matter. The company needs to get out of it because, you get like 50 software as a service products and services is stacked onto your company product roadmap or whatever it is. And all of these are basically variable costs that are increasing on a per usage because every single software as a service wants to have per usage, subscription based, software as a service model. because of course that's basically what all these SaaS companies want to have: better profits, better margins. But at the
That's
same
the
time,
dream.
that's the trend. But at the same time, all these other companies are doing the same, and then you have like one company stack 50 or 60 of those that are growing either with their employee base or with their customer base per usage of whatever. And so then you have to look, okay, so how is this company accounting for all that variable cost into their own product? So then you're saying, okay, so the price needs to keep going up and up and up and up and up and up for that, and that's not sustainable. So what I'm seeing in 2025 is that these products that are these management software companies that are being more successful, they either have a better approach at understanding the usage of this customer base. If you have a solution and your customer is using that solution for their employee stack, it's different as if this customer is using this product for their clients' growth, because
Hmm.
you cannot market and price that at the same way, because like
Right.
the customer that is using your service for their employer base is not seeing for their employee base is not seeing a direct variable cost item line when they're paying for your service, in compared to the one that is using it for their own clients.
The employees. Yeah. So the ROI. So it's like you're trying to calculate the price according to the value that the user is seeing from your platform. Did I get that right?
Yes, but you also need to be aware that if you're kind of like marketing or providing that same product to someone that is using it directly with their clients,
Mm.
sure, you're basically affecting ROI, which is like a much better kind of offering. But at the same time, you need to be aware that it's going to be a variable cost for that client.
But how can you do that? How can you track that? How can you change the pricing
The
if
best
it's the
companies that I'm
same?
seeing, they have multiple types of offerings, right? That they
Hmm.
can basically, so if you're a customer that is already looking for to use that for your client space in your own product, in the product you're selling to your clients, and you're using a third party software as a service solution that adds value to your product, then you're already looking for the most cost efficient solution. Usually
Hmm.
you're looking for something that you pay either a fixed cost, right, that you can leverage into
Yeah.
your product, or you're looking for something that the variable cost is so minimal that your own net profit can absorb it with no problem.
Hmm.
But in the opposite way, if instead you're using a software as a service solution that is for your employee base, you're not caring so much about the price point for that solution, because maybe you're going to make like 10 more hires the next month, so it's not going to be a very big variable cost on the overall kind of expenses for your bottom line, right? And it happens most times that like the same software as a service solution can be used for both use cases.
Wow. Yeah.
Does that make sense?
Okay. Yeah, yeah, yeah. It makes sense. I think what surprises me here is that, the same product, the same features can serve like so many purposes.
I'll give you an
I,
example.
I, yeah.
A calendar feature, like calendar software as a service, you
Mm,
can use it to have meetings with your own employees,
right,
or you
right,
can just have it to have like
right.
booked booked like cleaning house services, or you
But
can
then
have it
how
for.
do you track? But then how do you track in which way I use the software? How do you know if I use this calendar thing for my employees or for my customers?
You can ask the customer directly. It could be embedded on your product, how do you intend to use this? Or you can just have like a different tier, so that kind of like somebody that is going to use a lot of volume because it's embedded on their own product solution. If you're going to have like 5,000, calendars, it's not the same as somebody that's going to use 100 or 200, because that's their employee count or their head count.
Mm,
So for
yeah.
that 5,000, you need to have kind of like a better approach. I've seen like companies doing like open source with licensing, because you want to kind of like integrate and use their code base. But of course, it doesn't make sense if you're going to deploy that across thousands or hundreds of thousands of users. And that could be the difference from like a solution that is being used by somebody that when they started they have little users, and then they grow, and that company wasn't able to catch up with their pricing model, or didn't do their homework to catch up with their pricing model. And somebody that says, you know what, I'm going to do that from the scratch, because I have, I'm building infrastructure here, I'm building like highways, I'm not just building like
Wow. Yeah, no, that's super important. And yeah, new, I guess, at least for me. So it's important to stay on top of like new pricing models and how to really tailor it to the specific use cases, not only the specific features that your management software is doing. So that was a good one. Thanks for sharing. And yeah, so I'll get to the last question. Again, it's a bit theoretical, so if you need a minute, don't worry about it. If you had double the budget tomorrow morning, what's the first thing that you would do with it?
product sales and marketing.
But that's three.
I mean, if I have double the budget and I could only invest it in one thing, I guess distribution.
Like marketing?
I mean, it could fall in that category, but distribution is basically kind of either building a channel, finding a new channel, or building a product that is sole function is to distribute the current products that we have, the current products and services that we have.
Okay, so like to expand the reach of your product into new customers with a new channel. Why that specifically?
Because like I guess like distribution is like in our belief is the most important aspect, right? If you don't have distribution, doesn't matter how good your product is and how nice your technology is. If if people are not seeing your product, there's no point on having.
Mm-hmm.
Yeah, you can have the best product of the world, but if you don't have any customers, what's the point?
What's the point? Yeah.
Yeah,
Um, yeah. So thank you, Paulo. It was really great having you here with us today. Appreciate your time. It was a great episode.
thank
And
you.
yeah, I'll see you guys next time.
My pleasure. Thank you so much, Fran, for having me, and look forward to chatting again soon.